If you're getting ready for the UCAT, you know that the situational judgment section can feel like a total minefield, right? But what if I told you there's a single principle that can guide you to the right answer pretty much every single time? Well, today, we're going to break that principle down. It's called patient-centered practice. Let's jump in.
Welcome to EduRiff. I'm here to make your UCAT prep clearer, a whole lot simpler, and way more effective. So, the big question, how do you actually master those tricky situational judgment questions? Look, it's not about memorizing a giant list of rules. It's about really, truly understanding one core concept that's going to act like your compass in every single scenario you face.
And that core concept is patient-centered practice. Now, this isn't just some abstract idea from a textbook. Think of it as your practical master key. Once you learn to look at every scenario through the lens of what's truly best for the patient, you'll see the right answers start to just jump off the page. So here's our game plan. We're going to break down patient-centered practice into 4 key pillars. First, communication. Second, consent. Third, confidentiality. And finally, dignity and safety. We'll dive into each one, and I'll show you exactly how they all lock together. All right, let's kick things off with the absolute foundation of all good medicine, communication. Every single interaction you'll have with a patient is built on your ability to communicate well and ethically. This is where trust starts, or where it can all fall apart. Okay, now take a look at this. It really lays it all out, doesn't it? On the left, you've got the building blocks of trust. Using simple language anyone can understand, actually listening to what your patient is saying and showing empathy. And on the right, well, those are the trust destroyers, hiding behind complicated jargon or, even worse, just dismissing someone's concerns. In your exam, you are always choosing the path on the left. Now, dealing with relatives is a classic scenario in these tests. And let's be honest, it can be really tough. They're often worried, they're emotional. Your job is to be compassionate, to listen, but, and this is so important, you must never, ever break patient confidentiality. If things get heated or you're out of your depth, the correct answer is always to involve a senior colleague.
I want you to really let this sink in. Empathy is essential. Breaking confidentiality is forbidden. This is the tightrope you have to walk. You acknowledge their feelings, you show you care, but you protect that patient's private information at all costs.
Let's build on that and move to our second pillar, consent. This isn't just a good idea or a nice to have. It's an absolute non-negotiable legal and ethical requirement. It is all about respecting a patient's fundamental right to make their own decisions about their own body. For consent to actually be valid, it has to have these 3 things. Think of it like a 3-legged stool. First, it has to be voluntary. No pressure, no coercion. Second, the patient has to be fully informed about what they're agreeing to. And third, they must have the mental capacity to understand all that information and make a decision. If even one of those legs is missing, the consent is invalid, period. So what does this mean for you as a student? Number 1. Always introduce yourself as a student. Be upfront about it. Number 2, you must get clear, explicit consent before you do anything, even a simple examination. And crucially, if a patient says no, you respect that decision instantly. You don't try to persuade them, you just say, okay, and you stop. Moving on to our third pillar, confidentiality. You can think of this as the sacred trust that underpins the entire patient-doctor relationship. Patients share their most private, vulnerable information with us, and we have an absolute, unwavering duty to protect it. And this table here just lays it out so perfectly. In public spaces, like a hospital cafeteria or an elevator, you never discuss patients. On social media, absolutely not. Never post anything, even if you think it's anonymous. And here's the golden rule, the one that will never let you down. If you are ever unsure about what to do, you don't guess, you ask your supervisor. And that brings us to our final pillar, dignity and safety. This is where your role gets proactive. See, as a future doctor, you have a duty to not just avoid causing harm, but to actively protect your patient's well-being and their dignity. This is all about having the courage to act when you see something that isn't right. Let's play this out. Imagine you're on a ward, and you see a piece of equipment that's sparking or making a weird noise, and it's clearly upsetting the patient next to it. It might seem like a small thing, but patient safety is everything. So, what's your move? You escalate, that's it. You don't try to fix it yourself, you don't unplug it, and you definitely don't just ignore it and hope someone else deals with it. You find a nurse, a registrar, your consultant, whoever is in charge, and you clearly explain the problem. Your job is to be the eyes and ears that help keep the environment safe.
Okay, now for a much tougher one, a real test of character. You overhear a senior colleague making a dismissive or unkind joke at the expense of a patient who might be sedated or confused. Nobody else seems to have heard. What is your duty here?
And the answer is exactly the same. But it feels harder, doesn't it? This isn't about getting someone in trouble. It's about protecting the culture of care. That patient's dignity is in your hands in that moment. You must report what you saw to a trusted supervisor. This is how we make sure that patient dignity is non-negotiable for everyone on the team.
Okay, deep breath. We've covered the 4 pillars of patient-centered practice. Now let's bring it all together and see how this framework is going to help you completely ace the situational judgment test. So here it is, the big picture. Patient-centered practice is the seamless integration of all 4 of these pillars. It's about combining clear communication, valid consent, strict confidentiality, and a proactive defense of dignity to provide the absolute best, most ethical care possible.
So, the most crucial point is this. When you're in the exam staring down a tricky SJT question, I want you to run it through this mental checklist. Am I communicating clearly? Is consent being respected? Is confidentiality being protected? And is patient safety and dignity the #1 priority? If you can answer yes to those, you're on the right track.
Understanding these principles is a huge first step, but the next step is practice. If you're ready to really test your understanding and apply these concepts to hundreds of UCAT-style questions, then I really recommend checking out the EduRev app. You can find it right now on both the Play Store and the iOS App Store. Just search for EduRev, that's EDUREV, and download it. Because, acing the UCAT isn't just about getting into medical school. It's about becoming the kind of doctor you'd want looking after your own family. Are you ready?